about physical disabilities and other health impairments. First, the definition of physical disabilities is that it is a physical limitation or health problem that interferes with school attendance or learning to such an extent that special services, training, equipment, materials, or facilities are required. So my question is, if a student's physical disability does not adversely affect their academic achievement, they still qualify for an IEP? Is that true or false? The answer is false. If a student's physical disability does not adversely affect their academic achievement, they do not qualify for an IEP. Okay, so the classifications of physical disabilities are, they could be congenital or acquired, acute or chronic, episodic, or progressive. And we're going to talk more about these in a moment. So congenital disabilities encompass things such as Spina Bifida, Cerebral Palsy, missing limbs. These are things that, when it says congenital, these are things that are obvious at birth or happen at birth. Sometimes it may take, with cerebral palsy, it may take a few months to diagnose it, but it is something that happens at birth. Those are congenital. And then acquired are things such as spinal cord injuries or limbs lost in an accident, or as with a friend, a very close friend of mine, she lost her limbs to an infection. So that is something that is acquired, something that wasn't there from birth, but was acquired. Oftentimes in high school you may find students who, I've known a few high school students who had spinal cord injuries from car accidents and from other accidents, ATV accidents, those type of things. Those are acquired. Now, the other classifications is acute or chronic. Acute is limited duration. And limited duration would be such things as an illness, could be cancer, could be a student has leukemia, which is cancer, and has to miss school or has difficulty attending classes due to not feeling well or having to go for chemotherapy or having to have a long hospital stay. But chronic is a permanent disability, and a permanent disability would be such things as cerebral palsy, muscular dystrophy. It could be spina bifida. These are things that are permanent, that it is lifelong, not something that is acute, which is it may affect the person for a long time, or even if it's a long duration, it's still acute because it's not something that is permanent. So acute is limited duration, chronic is permanent. Further definition of the physical disabilities is it can be episodic. You have a student who has sickle cell anemia. They may be fine as far as they feel good, they're able to attend classes, but then all of a sudden their symptoms flare up and they're tired, or they have not a lot of strength, or they become sick. So this is a flare-up of symptoms. So those are such things as sickle cell anemia or cystic fibrosis. I did work with a student myself who had cystic fibrosis. And a lot of the times he was having to receive breathing treatments or go into the hospital. But then he would have months where he was doing well and did not have to miss much school. So then there is progressive. And progressive physical disability are things that are degenerative. There's muscular dystrophy that is degenerative over time. There are many classifications of muscular dystrophy, but most of the classifications of muscular dystrophy are degenerative. And there are some seizure disorders. Oftentimes seizures will cause small problems with processing in the brain, and over time, if they are severe enough, they will become degenerative. This is rare, but you can have some seizure disorders that are very degenerative. Okay, so question. A student with an acquired acute physical disability can still receive special education services. That is acute, an acute physical disability. True or false? The answer is true. A student who has an acute physical disability, such as they have an illness such as cancer, they can still receive special education services if it affects their academic performance. Okay, the prevalence of physical disabilities. It affects about 1% of the population. So about 1% of the population has a physical disability. 1/5 of them have multiple disabilities. 1/10 of them have orthopedic disabilities. And 80%, the large majority, have chronic health disabilities. Okay, a neuromotor impairment is damage to the brain or spinal cord before, during, or shortly after birth. So neuromotor impairments. These are things such as cerebral palsy, seizure disorder, and spina bifida. Cerebral palsy. There are many types, a number of types of cerebral palsy. And we're going to go over a few today. So the causes and types. Cerebral palsy has been described as it can be prenatal. That means something happens before the baby is born to cause there to be problems with the development of the brain. It could be perinatal. That means during birth, maybe lack of oxygen, those type of things. And then postnatal. It could be something such as a stroke or other things that would cause damage to the brain. Now, you have limbs involved. It could be quadriplegia, which is all of the limbs, all 4 limbs, or it could be paraplegia, which could be just the legs, or usually it's paraplegia, it's just the legs, not like arms, but it is both legs. And then there's movement type. There's spasticity. That is where the muscles are so tight that you have really no control over them. Very spastic muscles, very, very tight muscles. Like if you can see in the picture, the little boy's hands are kind of clasped. And so that is kind of, the muscle's not loose or, easy to move into different positions, but it's very spastic. Then there's chorioathetoid, and that is where the muscles will shake. And so a person with chorioathetoid movements has very, very, very shaky movements. Their head moves, their arms move, but they don't really have control of it. And then there's atonic, which is where the muscles are kind of stuck and don't move very well. That is more of a rare type, but that to say, you could have atonic muscles, where it's just you cannot move them. And then associated disabilities, and these are disabilities associated with cerebral palsy. Sensory, intellectual disabilities, but not all the time. Just because a person has cerebral palsy, we can't assume that they have an intellectual disability. This is just saying that an associated disability of cerebral palsy could be an intellectual disability. Oftentimes they have speech and language difficulties. And then emotional and behavioral disabilities, often stemming from not being able to communicate. Okay, and then there's seizure disorders or epilepsy. There are various causes, and those can include similar to cerebral palsy, the perinatal, the postnatal, and when, such as with cerebral palsy, got prenatal, perinatal, and postnatal. And sometimes it can be acquired over time. So maybe you weren't born with them, but the seizures could develop over time, or you could have a traumatic injury that caused seizures. So the classifications, you classify the seizure disorders by the duration of the seizures, the frequency of the seizures, the onset, like what causes it, what is happening right before it happens, the movements. It could be very, very small movements, just like facial movements, or it could be what many people associate epilepsy with is the whole body sort of movements. It's also classified by the causes of it, and then any other associated disabilities. And so kind of what you need to know is the fact that most seizure disorders are just classified by these areas. And then to control epilepsy, most individuals will take a seizure disorder medicine, and most of them will respond to medication, but serious seizure disorders may require medical intervention, such as there is something that's called a venous nerve stimulus. I believe I have that right, where it's like a pacemaker for your heart. It's in your brain, and it picks up whether it thinks that you're going to have a seizure, and it tries to combat that seizure before it happens. All right, spina bifida. Spina bifida is a neural tube defect. Basically, the brain and spine are affected. There has been for many, many years a movement, I guess a campaign to make sure that mothers who are either are thinking about having a child or are pregnant take folic acid, because that's been shown, in the research to reduce the incidence of spina bifida. But the educational and social implications for spina bifida are many, and these include things as mobility needs. Many people with spina bifida are unable to walk due to paralysis in their legs. Oftentimes they'll have medical problems, and some of those medical problems have to do with bladder control and other things. And so most people with spina bifida that I have met and that I've understood do require catheterization to drain any excess urine from their bladder. All right, and then some other major orthopedic or musculoskeletal problems. Those could be muscular dystrophy, juvenile rheumatoid arthritis, scoliosis, and you'll see some of these in these pictures, And then there's osteogenesis imperfecta, and that is where basically it's called brittle bone disease, where the bones are very, very, very fragile and they break very easily. So those are some other things you might see. Other conditions that may affect the health and physical ability of students, there is the fetal alcohol disorder, and you'll see that in the picture to your right. You'll see that, I believe it's a girl, in that picture has fetal alcohol syndrome. And you'll see oftentimes they have more sort of almond-shaped eyes, like a flatter nose. So there are some facial features that come with individuals who are born with fetal alcohol syndrome. And then there's AIDS, and there's accidents. Okay, question. Which of these is the most prevalent physical disability in school-age children? Do you think it is cerebral palsy, seizure disorders, spina bifida, or muscular dystrophy? The answer is cerebral palsy. That is the most prevalent physical disability that you will find in school-age children. Okay, prevention of some of these physical disabilities. Safety precautions while you're pregnant, improved health care, prevention of teen pregnancies, prevention of child abuse, prevention of conditions that cause brain or spinal injury. So these are things that we can do to maybe prevent some of these physical disabilities. All right, and then there's adaptations. You have prosthetics and you have orthotics. And the difference is, a prosthetic is, if you can see at the bottom, there's a girl there who has, she's displaying some of her prosthetic legs that she's had over the years. As she's gotten taller, she's had to have some new ones. But a prosthetic is something that replaces a limb. And as you can see there, one of those is replacing her limb, the prosthetic leg. An orthotic is something that is a brace. There is a picture, I believe it is back here. This child. See this boy who is on the ball? He has a orthotic, and that is a brace. It's a positioning device to help to kind of put the muscles and the bones and stuff in the right position. So that's the difference. Okay, so a prosthetic is something that replaces a missing limb. An orthotic is basically a brace. An adaptive device might be something like the child on the right who has a walker. So these are adaptive devices that are used to help him walk, are there to help him walk. And you might have things such as if you have a person who they have their hand maybe doesn't work very well, but they haven't lost their limb, but they're not able to use their hand very well. There are some devices that they can use to help them to grip things and pick things up or type or those type of things. That's adaptations. All right, the major education implications. We really want to emphasize independence and activities of daily living. We want to emphasize access to peers without disabilities, and we talk about that a lot in class. We want to make sure that our students have as much time as they can with students without disabilities. Integrated therapy, that means sort of that transdisciplinary approach where you have the speech pathologist working with the physical therapist, working with the occupational therapist, working with the special ed teacher, working with the general ed teacher, everyone working together to to provide the services that the student needs. And when it comes to therapy, when it comes to like speech therapy and physical therapy and OT and occupational therapy, they can work together to make sure that for example, the student is in the right position to then be able to use a communication device to speak with their friends at circle time. So, and that brings me to the next one. It's the development of a communication system. And I am currently doing this for my dissertation. And I have found that this is something that really, really needs to be emphasized. The development of a communication system. And then fair assessments that don't penalize individuals based on physical disabilities. So finding a way to assess the strengths of a student with a physical disability that is, doesn't bias the results because they're not able to answer the way the test is designed. And then bringing in specialists. Sometimes when you have a student with a physical disability, the parent might invite the doctor or others to the meetings. I've not seen that, but I have heard that is something that can be done. So, and then the importance of early intervention. We talked about early intervention on Tuesday. And it's very, very, very important for students with physical disabilities. They get the therapies that they need as early as possible. And then going to the other end of things, talking about transition and transitioning from high school. You could say transitioning from elementary to middle. There are many different barriers when you go from elementary to middle, going to class, going to your locker, those type of things. So looking at those transitions, and definitely looking at transition from high school to adulthood. Okay, question. A child with a physical disability should be educated where? With homebound instruction? In a special classroom for children with disabilities? In an inclusive classroom with non-disabled peers? In the setting that best meets their needs? And I bet we can all answer this. In the setting that best meets their needs. Now that you have listened to the information that I have given you about physical disabilities, I want you to watch each of the 3 video links that are on Canvas below this video. Please watch them and and while you're watching them, think about the impact those videos might have on your future career when you think about how to best meet students' needs in your classroom or in your future careers. Thank you.